Hi teacher, our names are Natalia Penagos, Mariana Cano, and David Quiroz, and we are going to tell you something about self-medication in our life.
Hi, my name is Natalia Penagos Mesa, and today I want to show you a little about why self medication is a subject that we should all know about. And also, I want to tell you our posture. For starters, I am here with my mother, Jenny Patricia. Mom is going to give us a little of her time. Hola, mami.
Hola.
Quería preguntarte, ¿sabes qué es la automedicación?
Sí, es uno mismo medicarse.
¿Crees que es correcta la automedicación?
No,
¿Por qué?
porque puede ser dañina para nuestro organismo.
¿Alguna vez te has automedicado?
Sí,
Well, this is what plenty of us know. Nonetheless, discover some arguments against and in favor of self-medication.
Some of you wonder why self-medication could be so risky. Well, some entities like Public Health of La Rioja respond to this question and tell us some of the risk. Toxicity is one of them. In this case, the patient could present adverse reaction and poisoning. Lack of effectiveness is also a risk because the medicines are used in unindicated situations. On the other hand, some patients present dependency or addiction to. Also, according to doctor and scientist Darshana Benadi, irrational use of antimicrobials without medical guidance may result in greater probability of inappropriate therapy, misdiagnosis, delays in treatment, and could increase morbidity. In the same way, self-medicate not only affects your health, it affects your economy too. Daniel Ricardo Delgado, Master in Chemistry and Doctor in Pharmaceutical Science, says that self-medication could cause the development of other possible pathologies, which will increase the cost of the treatment. Consumers become more ill and are forced to go to the doctor to solve a much more serious and costly disease.
Hello, I am David Quiroz. I am gonna tell you the antithesis of the self-medication in our lives. It will seem for certain doctors self-medication as long as it's responsible. For example, according to Rioja Health, when you self-medicate to treat minor symptoms such as fever, hairburn, cold, you aren't putting your health at risk because they are mild and possible simple to treat. It's not too important whether you previously had a prescription for this or not. On the other hand, sometimes more than once in the self-medication becomes in a necessity. For example, the Dr. Abel Hernandez says that the RPS medicine that are dispensed without a prescription and they aren't being harmful. These drugs become a simple alternative for more than one citizens and much more accessible, as many times prescribed drugs have a much higher cost.
My name is Natalia Penagos Mesa. Bicycle self-medicate has positive and negative points, which depend more than anything on illness that each individual has. For example, as stated by Veronica Biancos Gomez, 2016, it may be helpful is used to treat minor symptoms, such as stomach pain or heartburn, and for a limited time. However, if the patient is not adequately informed about these medicines and their symptoms are rare or unknown, that prescription drugs are available, it is essential to visit the doctor and follow his prescription properly. Finally, when deciding whether to self-medicate or not, you have to look at the context you are in, the difficulties you have. But it's clearly recommended by doctors to visit the doctor you trust and not to establish a verdict of your own. Remember that any medical difficulty must be treated or minimal. Revise. No matter how strict it is to consume any medicine without a prescription.